Sonography of urinary bladder. We will talk about some cases that affects the urinary bladder, ranging from bladder hematoma, bladder stone or bladder calculus, and vesicoureteric junction stone or calculus. We will also talk about bladder suspicious mass, vascular masses that are attached to the wall of the bladder and do not change position as the patient moves. Bladder hematoma. This is intraluminal collection of blood in the urinary bladder. Causes. The most common cause of bladder hematoma is trauma, followed by hemorrhagic cystitis and renal mass. A huge renal mass can cause intraluminal collection of blood within the bladder. The clinical presentation of bladder hematoma includes painful urination, which is dysuria, urination of blood, hematuria, and pelvic pain. This image represents urinary bladder hematoma. You can appreciate the intraluminal mass. The patient's clinical history includes a male in his mid-40s, difficulty and painful urination, urinating blood, and there is a huge simple renal cyst in the right kidney, which is not shown in this lecture. On grayscale ultrasound, the mass is an avascular mass that is gravity dependent, in the sense that it changes location as the patient moves from supine to left lateral decubitus. In our own case here, the mass is echogenic. It can also be heterogeneous, containing both hypoechoic and hyperechoic areas, depending on when the ultrasound scan was done. In most of the cases, the echogenic part represents areas of active hemorrhage. Looking at the video, you can appreciate the mass. On Doppler interrogation, no flow was indicated within the mass. Here is another case of urinary bladder hematoma. You can see that the mass is echogenic, no flow was seen, and it is gravity dependent. In order for intraluminal bladder mass to be a hematoma, make sure that it is gravity dependent and it is also avascular. Vascular masses are suspicious. Bladder stone, also known as cystolith or vesicular calculi. They are hardened mineral deposits within the urinary bladder that are formed when urine is retained for a very long time. It is more common in men that are in their 50s. The sonographic features includes a mass that is very echogenic with posterior acoustic shadows and gravity dependent. The clinical presentations includes, but are not limited to, the following. There is interruption of urine stream, there is painful urination, blood-stained urine, and there will be frequent urge to urinate. Here is a urinary bladder calculus marked with red, and the yellow line represents the posterior acoustic shadows. You can appreciate the urinary bladder stone or cystolith. This is the video of the urinary bladder calculus, demonstrating strong posterior acoustic shadows. This is a huge vesicular calculi with posterior acoustic shadows measuring 62 by 63 mm. There is associated cystitis. The bladder wall is also thickened and there is internal echoes in the urine. This is another huge urinary bladder calculus with posterior acoustic shadows. The urinary bladder wall is also thickened, so there is associated cystitis. You can appreciate the size of the urinary bladder mass. Here is the video demonstrating the huge urinary bladder calculus. VUJ stones. These are stones seen at the vesicoureteric junction. The source is usually the kidney. You can look at the calculus there at the right vesicoureteric junction. You can appreciate the posterior acoustic shadows in pink. The stone measures about 8.8 millimeter. Here is another stone in the left vesicoureteric junction. You can appreciate the yellow line demonstrating the posterior acoustic shadows. This mass measures about 9.3 millimeter. That is the calculus. That is how it is appearing on color Doppler interrogation. Suspicious bladder masses. Alright, these are masses that are most likely not going to be benign. They have malignant features. Their sonographic features are pointing towards malignancy. They are mainly adherent to the bladder wall, not gravity dependent, and on Doppler interrogation there is usually flow. However, ultrasound is not the gold standard. It's not used for staging of bladder cancer, but at least it can give some overview of how the mass looks like and the extent of the invasion or the infiltration of the mass. The clinical presentation of these suspicious bladder masses are usually painless hematuria. We are going to take a look at some cases. Here is a suspicious mass. It is echogenic, vascular, and adherent to the bladder wall, protruding into the bladder lumen. You can see that on Doppler interrogation that there is flow within that mass. A differential diagnosis of ureteral cell carcinoma was given. Look at another mass here. It is a sessile mass in the urinary bladder involving the ureterovesical junction, and there is flow on Doppler interrogation. A differential diagnosis of ureteral cell carcinoma was as well given. This patient has a history of painless hematuria. You can appreciate the flow there. So what is this? The patient's clinical history is dysuria and hematuria. Is it a neoplastic process? You can see that the mass is avascular and it is gravity dependent. This is a classical case of urinary bladder hematoma. Thank you so much for watching. Please subscribe to support what we are doing.